Hi everyone, thank you for watching this video. We are from Team 11. Our title is Survey on Type of Heart Disease Contained by Patient in a Hospital. Our team members is Lia Nasuha binti Ahmad Amran 27688, Masriani binti Abdurrahim 277044, Chiu Cheng Kwan 278154, and Muhammad Amirul Azizi bin Subagi 281037. Hi everyone, my name is Masriani binti Abdurrahim. My metric numbers 277044. For the introduction, I will tell you about what is heart disease. Heart disease can be described as range of conditions where your heart not in the good condition. Just like other disease, heart disease also can be detected through several symptoms. Heart disease symptoms are much likely chest pain, shortness of breath, pain or numbness in your leg. Moreover, there are 4 types of chest pain, which including typical angina, atypical angina, non-angina pain, and asymptomatic. From this research, we will be able to tell you about the type of chest pain and its effects on certain group of people who having it. In the end of our study, we hope to be able to share the complication of heart disease together with educating people out there about the consequences of the heart disease. Next, we move to the objective of the study. The objective of this research of heart disease is first, to identify the symptoms of heart disease, second, to identify the impact of heart disease to patients, and third, to emphasize the cause of heart disease to patients. Now, I will talk about the age range of patients tested for heart disease problem. From the analysis, we can see that the highest number of patients with average age of 55.5, which is 53 to 58 years old, have the most attendance currently by 40 people. Meanwhile, the lowest number of patients have been tested is average age of 31.5, which is 29 to 34, and 73.5, which is 71 to 76 years old, with the presence of 2 people for both category of age. The total participated of the patient was calculated up to 150 people. Now we will move to the percentage of patient attendance for the checkup according to the agenda. From the pie chart, we can see that the male patient currently has higher presence during the heart disease checkup with 71.33%, while the female patient only counted as much as 28.67% from 150 people. So that's all from me. Thank you. I will pass to the next presenter.
Hello, I am Lia and now I'm going to explain a few variables of the heart disease survey. From the data figure, you all can see the 4 types of chest pain. Typical and atypical angina are symptoms that will leave the patient with heart attack. Non-anginal pain is suffered by non-heart disease carrier, but it may bring pain to the breastbone with squeezing pain, while asymptomatic will show no symptom before the chest pain suddenly attacking the patient. Overall, the highest record of patient is suffering from asymptomatic types with 66 in frequency. Next will be raising blood pressure dataset. The main dataset that can be derived from the data figure is the mean. Highest one is entitled to hypertensive blood pressure level with 119, whereas the lowest is on elevated blood pressure level. The mean indicates the degree of chances of the patient to have severe complication of heart disease. Besides, the standard deviation is telling us about the variation of data from the mean. The highest score is 14.142 on the hypertensive blood pressure level. Then we will go to blood cholesterol analysis. From the data figure, we all can see the differences in median between the normal, elevate, and high cholesterol level, as the high one is having the biggest median value of 240. The median is used for central and tendency measurement. The dataset is also showing the interquartile range between the levels of cholesterol, as normal got 194.5, elevate got 219, and high got 290. Besides, there is data set for fasting blood sugar. The data figure shows that there is 126 patients are having lower sugar level and only 24 of them are having high blood sugar level within their blood. The higher the sugar level found within the blood indicates the highest possibility of the patient from having diabetes, which later led to coronary heart diseases. Subsequently, I'm going to share the result of stressing electrocardiographic by the patients. From the data figure, we can see the frequency of patients having normal electrocardiographic test about 68 people, while the one having probably or definite left ventricular hypertrophy is 82 people. There is no reading for ST wave abnormality. The 82 patients will face an increase of left ventricular mass due to its wall thickening, and cavity enlargement led them to have heavy breathing and chest pain. So that's all from me. Let's move on the presentation with the next presenter. Thank you.
Hello guys, I'm Amirul and I will continue with the next chapter of the presentation. Okay, then I'm going to share the chart of maximum heart rate of the patient. The most prominent data I would like to discuss is the mean. The highest one is shared by group with range of 196 to 210, whereas the lowest one is between 97 to 111. The data mean indicates the rate of risk of the patient which may suffer from supraventricular tachycardia, which send a shock wave to upper part of the heart and causing a dysfunctional of the heart. Second data will be standard deviation. It shows the variation of the data. Currently, the highest is 5.769, whereby the lowest is 0. Hence, 95% of the patient categorized as heart disease patient. Next will be exercise-induced angina. The ratio of people who tested positive with this symptom is 102 out of the 150 patients. The impact of the result indicates the hardness of an individual to breathe normally due to obstruction of blood flow into the heart muscle, probably caused by plaque form. Then, exercise-induced ST depression by patients. The highest point for the mean will be an all-peak class of 5.4 to 6.2, whereas the lowest is shared by both of all-peak classes of 3.6 to 4.4 and 6.3 to 7.1. The higher the mean indicates the higher possibility of getting ischemia, which is low supply of blood to heart tissues. Moreover, the standard deviation data is showing the greatest variation entitled class of 0.9 to 1.7. Not every exercise-induced ST depression led to ischemia, but it shows the higher risk of having relentless of cardiac events in the future. Plus, let's see the result of type of slope by electrocardiogram test. The number shows that 71 with upsloping scale, 14 with downsloping scale, and 65 have flattened ST segment. The combination of patients between upsloping and downsloping ST segment during ECG test will perform a diagnosis of myocardial ischemia disease presence. The condition is defined as a blockage of blood flow into heart due to narrow of coronary arteries by plaque. Therefore, there is about 56% of patients are suffering the symptoms of the heart disease. Subsequently, there is data figure of number of major vessels colored by fluoroscopy. As everyone could see, there is 94 patients didn't show any sign of fluoroscopy within the major vessels. The rest, 56 of them reported disease in the heart valve, either at mitral valve, aortic valve, tricuspid valve, or pulmonary valve. This condition might cause to dysfunction of blood flow into the right chamber, or the blood will be forcefully pumped into narrowing opening, which led to heart failure or cardiac arrest. The more color found indicates the critical point of patient's heart state. Again now, let's continue with the next presenter.
Thank you, Mohammed Aminul. My name is Chuchenko and matrix number 278154. Now I would like to present the data patients blood detection in thalassemia. Based on the horizontal bar chart shows, you can see that 79 patients out of 150 patients has the normal blood detection in thalassemia, and meanwhile there are 63 patients which are irreversible detection blood in thalassemia, and patients that have this detection in thalassemia has 7 patients out of 150 patients, and only 1 patient which are undetected in thalassemia. The mode of patient in thalassemia blood detection is the normal ones. Next, I would like to show the data, present the data, the angiography disease stage of patients. Based on the bar chart shows, we can see that the highest frequency of patients angiography disease stage is 83, which are 0 more than 50% diameter narrowing. The second highest of the patients angiography disease stage is 1 more than 50% diameter narrowing, which is in total 27 out of 150 patients. In conclusion, based on the analysis data, we can see that age range 55.5 from 53 to 58 years old have the highest number for attended the heart disease program tested. And meanwhile, for the gender, we can see the big gap between the male and female, which is the male patients have high percent than the females. There is 71.33% or over 150 people. Moreover, the analysis for the patient heart disease, we can observe the number of patients that asymptomatic chest pain is higher than other type of chest pain, with 60% of them detect to have this type of chest pain. Next, the number of measured versus colored by fluoroscopy, the most frequency is number 0, which is 94 patients out per 150 patients. Percent for number 0 of measured versus colored is 372.7%. In conclusion, based on the study above, you can see that people who is in the age 50 and above can consider have a heart problem disease and must get help checked in hospital above clinic. You can see also among 4 types of chest pain, heart disease and asymptomatic is the most type they have experienced by the patients. Lastly, the optimal ratio help means the must active speed is one of the check for the heart disease, so we can avoid people from dying because of heart disease. Thank you.